great to be here with you, Senator Casey, and thank you everyone for tuning in here. We're gonna get started in a minute, but I just wanted to start this off by talking a bit about my patient advocacy and my specifically work with Senator Casey. Senator, it's been such an honor to work with you these last 5 years and your staff. You've been such an inspiration to me, and your compassion really knows no bounds. Thank you for what you did on the floor yesterday and vote for veterans healthcare. You've always gone out of your way to make sure that the voices of your constituents were heard. You reached out into rural areas. You've done things that I've not seen other senators around the country do. You've always go above and beyond, and you're an exceptional senator. And I bestow you the Peter Morley Award for senator with the most compassion. And thank you for everything that you do for healthcare.
Well, Peter, thanks so much for all those accolades, but I could return them and add to them when it comes to your work. You've not only been a champion, but been an effective advocate here in Washington and around the country for a goal that I think we all share, which is to make sure that every American has access to health care and to the kind of quality care that every American, every family should have the right to expect. So as much as we made some real progress in the last decade, obviously with the Patient Protection and Affordable Care Act, we also have miles to go to complete the work, and that means we've got to take action this week on this, what people in Washington call reconciliation, but we know is the legislation that will help us reduce inflation. Part of that is to focus again on the Affordable Care Act to make sure that the subsidies are in place. I want to do more than that, however. I want to make sure that we're providing opportunities for people with disabilities, as well as seniors to have access to home and community-based services. So that's work that still has to be done. But this week we can take action in the Inflation Reduction Act, not only by making sure the subsidies stay in place for the ACA, but also to make sure that we're finally going to take action in a substantial way to lower the cost of prescription drugs and to allow Medicare for the first time to negotiate for lower prices. So a lot to do to help get costs down for families and to help our economy and to move the nation forward. But even after this week, as much as that will be progress, we'll still have more work.
Well, you took away my first question, which I was going to ask you about what you're doing to expand access to quality and affordable healthcare, which I'm very, very happy to hear, and I'm sure the listeners are very excited to hear, and I have no doubt that you'll continue to be an incredible advocate for that. I do have a question for you that I know is really top of a lot of people's mind. What are you doing in the Senate to protect Social Security, Medicare, and Medicaid from these GOP attacks? I mean, there's been some really divisive, really, standing their ground, and just very, very personal, partisan attacks on these programs.
Yeah, Peter, you point to another part of the challenge here. Part of the challenge is to make sure that we're making progress to continue to protect and strengthen and really expand what we did in the Affordable Care Act, 30 million Americans covered. But that's also true when it comes to protecting Social Security, Medicare, and Medicaid. But advancing policy and winning legislative battles on those policies is not enough. We also have to stop the effort by Republicans on all of these programs. You know better than anyone the efforts that you were fighting against when the Republicans started to go down the path of trying to repeal the Affordable Care Act. They failed.
And still fighting.
Right.
There's that case in the Supreme Court that most people don't know about to undermine the ACA again.
Exactly. They haven't given up just as they failed in the summer of 2017 when that vote went the wrong way for them. Yep. They're still trying, and God help us if they get a majority in either house, they would try again, and as they would as they would at the same time try to decimate Medicare and undermine Social Security. I think it's not just a rhyme to say that they're trying to privatize and voucherize. They're trying to privatize Medicare or privatize Social Security, and they're trying to voucherize Medicare. These are not theories. These aren't hidden secrets. They're
Right.
upfront about it. They're blatantly trying to do it
Yeah.
for years. And just because we defeated them in 2005, a year before I got elected to the Senate, 2005, the Democrats in the Senate defeated the efforts to privatize Social Security. Republicans still want to do it. They
Yep.
haven't given up on that. They haven't given up on repealing the Affordable Care Act. They haven't given up on voucherizing the Medicare program. And as bad as that all is, just when we thought they couldn't get any worse, Republicans in Congress now, it's their official position to sunset all federal programs in 5 years. All programs in five
Yeah.
years. Social Security sunsetted, Medicare sunsetted, Medicaid sunsetted. Last thing I'll say is that I didn't get to Medicaid itself. Medicaid is the program, unlike Social Security and Medicare, where they're an earned benefit, where the worker pays in and should have the protection and the benefits of those programs because they worked their lives to pay in. Medicaid's different. It may not be an earned benefit per se, but Medicaid is the program I believe that tells us who we are as Americans, whom we fight for, whom we value, and the kind of nation we're going to be. Medicaid is the program that helps low-income families and children have health care. It helps people with disabilities. It helps our seniors, even middle-class seniors, get into nursing homes. The Republican Party has been determined for many years now and proposed budget after budget to cut the Medicaid program by 50, 60, 70 billion dollars each and every year for 10 years when they proposed cuts of 500 billion, 600, 700. One year the House Republicans, I think it was 2018, even proposed cutting Medicaid by $1 trillion. That's
Yeah.
100 billion a year. So they're trying, we got to defeat those efforts.
It's still shocking to me that still 11 states, as of this
Right?
conversation, that do not have expanded Medicaid, and especially in states like Texas and Florida, where combined would help over 2 million of their citizens. It's just shocking that
Yep.
it's just money on the table. They're just leaving there and leaving their health care on the table and letting these people go uninsured.
Well,
It's
Peter, the last
unbelievable.
thing I'd say about what's coming up is, and I should have mentioned this, this Inflation Reduction bill that we're going to be voting on this weekend, probably Friday through Saturday or Friday through Sunday, when we have to do amendment after amendment, because Republicans are doing everything they can to stop us from having Medicare negotiate for lower prices. Simple as that. They're going to try to stop us. They're going to try to stop us on our efforts to push back against climate change. But we're going to defeat them for sure, but it's going to take a while. But here's one of the benefits of passing that bill. It'll not only give Medicare the authority to negotiate lower drug prices, that's good. It'll lower costs for millions of families, but it'll also save taxpayers by one estimate, $290 billion. Let's just round it off and say $300 billion, which will have the effect of not just helping our bottom line, it'll help us extend the life of care. And again, every Republican in the Senate will try to prevent that from happening this weekend. Every Republican in the Senate will be against it. So we're gonna win, but we're gonna have to fight hard, and we're gonna need the support of everybody that's listening to us today.
Well, you have our support. I got one last question for you. Uh, how would the Better Care, Better Jobs Act improve health care for seniors and people with disabilities?
This would be a great breakthrough. I wish I could say we're going to be able to do that this weekend, but we're not. But we're going to keep fighting on this. Really, when you're talking about this bill and the impact of it, you're talking about four groups of Americans: seniors and people with disabilities. They're the first two. The third would be family caregivers. Everyone you know has someone or knows someone who's taking care of a loved one. Tens of millions of families are doing this every day. Out of an act of love, they take care of a family member, they leave a job or a career to do it. They save the rest of us a lot of money, but they burden their families because, someone who's doing one kind of job isn't trained to be an at home caregiver, or the equivalent of a nurse or a medical professional, but they do it because they love their parents, they love their families. So those four groups of Americans: seniors, people with disabilities, and family caregivers. The fourth, I should say, would be the workers. Imagine this: workers who provide that essential heroic care, taking care of a senior, taking care of a person with disability. in their homes or in the community. They make $12 an hour. $12 an hour.
Yeah.
We can't call ourselves the greatest nation on the earth if we're paying people only $12 an hour on average to provide that home care. So what we would do is we're going to take, passing this legislation, we would expand, again, the program I just talked about, the Medicaid program, so that states can expand their programs to provide more opportunities for seniors and people with disabilities, the chance to have care in their home. Now, if someone is a senior and they want to have care in a nursing home, that's fine. They can go to a skilled nursing facility. But we should have the same opportunity available through the Medicaid program for a senior who wants to get care in their home, or a person with a disability who might need only 2 hours of care in the morning before they go to work
Right.
and have a job and contribute and live a life of dignity.
Right.
So that's what we're talking about here. The good news here is the American people are not going to stand for Washington sitting on its hands on this. They're going to demand that more and more families, tens of millions, have opportunities for home care, and that people with disabilities have a chance to live in a community or to get care in their home. So this is going to happen. We just don't know when. We got to keep fighting for it.
Well, I thank you so much for that. It's a very personal issue for me since I live with disabilities and I've had home care before. Thank you so much for fighting for that. And again, thank you so much for everything that you did on the Senate floor to get that PACT Act passed. My friend Ted Corcoran has advocated with me. We've met together with you on this. He shared his personal story. It's such a I can't even tell you how grateful I am to you and every senator that voted to get that done. And that's the wonderful hope that we all have, is to that we can make things happen if we all work together. And that's what we need to do. So you have our support weekend, and you'll have our support with the Better Care, Better Jobs Act. And thank you for everything that you do, Senator Casey. You're a real American healthcare hero.
Peter, thank you, and thanks for all the work you've done, from the PAC Act to ACA to these fights on Social Security and Medicare. We appreciate your work.
Thank you. Always have my support.